Hello friends, welcome back to Learning Nails and Aesthetics. We are in the Milady Nail book, Chapter 4, Nail Structure, Disorders, and Diseases, starting on page 97. We'll be going to page 102. Keep in mind, I am not AI, so mistakes will be made. Just laugh along with me. And don't forget to check out my other videos, the Milady Aesthetics book, as well as the Milady Foundations book. Then, of course, a lot of unboxing and trying various polishes, items from Temu. Let's get started. Oh, one more thing. I did already have my coffee. Let's see if that helps. Nothing in life is to be feared. It is only to be understood. That is a quote from Miss Curie. Learning objectives. After completing this chapter, you will be able to 1. Explain why you should learn about nail structure, disorders, and diseases. Define the natural nail unit. 3. Label the structure of the nail. 4. Describe the factors that affect nail growth. 5. Identify unhealthy conditions of the nail. Outline the scope. Number 6. Outline the scope of practice for your license related to nail structure, disorders, and diseases. Explain why you should learn about nail structures, disorders, and diseases. To perform professional and responsible service and care, you need to learn not only about the structure and growth of the nail, but you must also identify when it is safe to work on a client. Having a thorough grasp of nail structure and growth allows you to expertly groom and beautify nails. This knowledge also prepares you for more advanced nail services. You must be aware of unhealthy conditions that you may encounter while servicing clients. Some of these conditions are easily addressed in the salon. Hangnails, for instance, or camouflaging a bruise on the nail bed, but some are medical conditions and/or infections and warrant the attention of a physician. Nail technicians must be able to differentiate between healthy and unhealthy conditions on a client's nail for several reasons. First, you must be able to identify conditions that could not be treated in the salon. Second, you need to take appropriate steps to protect yourself and your clients from the spread of disease. Finally, you could be in a position to see conditions that may signal mild or serious health problems that require the attention of a doctor. The natural nail is the hard, protective plate that protects the tips of the fingers or toes. It is an appendage of the skin and is part of the integumentary system. The nail plates protect the tips of the fingers and toes. Their appearance can reflect the general health of the body. Nail technicians should have a thorough understanding of nail structure, disorders, and diseases because understanding the structure and growth of natural nails allows you to expertly groom, strengthen, and beautify nails. You may also offer clients guidance on maintaining healthy nails and proper home nail care. It is important to know the difference between the nail cuticle and the eponychium before you perform nail services. Understanding the structure and growth cycles of the natural nail will prepare you for more advanced nail services. Define the natural nail unit. The natural nail unit is made up of several major parts, including the nail bed, matrix, nail plate, cuticle, eponychium, hyponychium, specialized ligaments, and nail folds. All of the parts of the finger from the tip to the first knuckle are referred to as the natural nail unit. The natural nail itself is technically referred to as the onyx and is composed mainly of keratin, the fiber-shaped protein found in skin and hair. The keratin in natural nails is more durable than the keratin in hair or skin. A normal healthy nail is firm and flexible, shiny and slightly pink in color. Its surface is usually smooth and unspotted, with no splits or deep grooves. A healthy nail should be whitish and translucent in appearance, with the pinkish or beige color of the nail bed below showing through. Check in. What is the technical name for the natural nail? Natural nails are composed mostly of what protein? Describe a normal, healthy nail. Label the structure of the nail. The natural nail is divided into several major parts, including the nail bed, matrix, nail plate, cuticle, proximal nail fold, eponychium, hyponychium, specialized ligaments, and nail folds. Each of these parts form the natural nail unit. Figure 4-1 is a structure of the nail unit. If you are just listening, it is a good idea to either pause the video and look at it later or replay later. I prefer replay. Hint, hint. Also, don't forget to comment, like, share, and subscribe. I have lots of people watching. Not many are giving a thumbs up. Maybe you just forget. If you watch the video all the way through, it was helpful to you. Please do that, as well as a comment, even if it's just a smiley face or a heart or whatever you would like to put in there. A short little hello. Something. I would really appreciate it. So we are page 99, figure 4-1, structure of the natural nail. It points out the matrix, stem cells in the eponychium layer, stratum corneum, proximal nail fold, abbreviated as PNF, keratinized proximal nail fold tissue, the cuticle, nail bed, nail plate, hyponychium, and digital phalanx, which is the fingertip bone. Phalanx. Yeah. So it's very important to actually have a really good look at this, because a lot of people confuse the cuticle with proximal nail fold, or it's a kind of become an umbrella term, and it is not. So have a good look. Nail folds. The nail folds are folds of normal skin that surround the nail plate. These folds form the nail groove on each side of the nail. The lateral nail fold, also known as the side wall, is the fold of skin overlapping the side of the nail. Proximal nail fold, PNF. The proximal nail fold is the entire flap of skin covering the matrix, extending from the edge of the visible nail plate to the first joint of the finger. This tissue folds back underneath itself to create a flap of tissue that shields and protects this sensitive area. According to research conducted by Doug Schoen in 2019, the upper part of the proximal nail fold is covered with skin called the stratum corneum, which is typical of other parts of the body. In the area where the skin meets the nail plate, it has a different appearance because it is keratinized. In other words, in this small area, the outer layer of tissue undergoes a process that causes the surface cells to produce larger amounts of keratin. This keratinization process hardens the PNF tissue and gives it a slightly different appearance. This hardening creates a protective outer barrier that resists attack by infectious organisms or potentially harmful chemicals. Nail plate. The nail plate is the hardened keratin plate that sits on top of the nail bed. It is the most visible and functional part of the nail unit. It is formed by the matrix cells, whose sole job is to create nail plate cells. While it may appear to be one solid piece, it is constructed of approximately 50 layers or less layers. That doesn't make sense. While it may appear to be one solid piece, it is constructed of approximately 50 layers or less layers of nail cells. That could have been written better. As it grows, the nail plate slowly slides across the nail bed. The free edge is the part of the nail plate that extends over the tip of the finger or toe. The nail plate is relatively porous to water, meaning that it can absorb some moisture. The water content of the nail is related to the relative humidity of the surrounding environment. A healthy nail may look dry and hard, but has a water content of between 15 and 25%. The water content directly affects the nail's flexibility. The lower the water content, the more rigid the nail becomes. Using an oil-based nail conditioner or nail polish to coat the plate can reduce water loss or excessive water absorption and improve flexibility. Nail bed. The nail bed is the portion of living skin that supports the nail plate as it grows towards the free edge. Because it is richly supplied with blood vessels, the area under the nail plate can have a pinkish appearance in the area that extends from the lanula to the area just before the free edge of the nail. The nail bed contains many nerves and is attached to the nail plate by a thin layer of tissue called the bed epithelium. Epithelium. The bed epithelium helps guide the nail plate along the nail bed as it grows. As a professional, you should understand the difference and use the proper names for the parts of the nail unit. For example, nail polish is applied to the nail plate, not the nail bed. Matrix. The matrix is the area where the nail plate cells are formed and extends from under the nail fold at the base of the nail plate. It is composed of matrix cells that produce other cells that become the nail plate. The matrix area contains nerves, lymph, and blood vessels to nourish the matrix cells. As long as it is nourished and kept in healthy condition, the matrix will continue to create new nail plate cells. The visible part of the matrix that extends from underneath the living skin is called the lanula. It is the whitish, half-moon shape underneath the base of the nail plate. This appearance is caused by the reflection of light off the surface of the visible part of the underlying nail matrix. The lighter color of the lanula shows the true color of the matrix. Everyone has a lanula, but not all lanulas are visible. Some are short and remain hidden under the proximal nail fold, abbreviated PNF. The growth of the nail plate can be affected in an individual. Let's back up. The growth of the nail plate can be affected if an individual is in poor health. If there is a nail disorder or disease present, or if there has been an injury to the matrix. Cuticle. The cuticle is the non-living, colorless tissue attached to the nail plate that comes from the eponychium located on the underside of the skin lying above the natural nail plate. The cuticle becomes strongly adhered to the nail plate while still underneath the proximal nail fold and pulls away and adheres to the upper surface of the nail plate as it grows outward. The cuticle forms an important seal between the PNF, and remember the PNF is the proximal nail fold, Lost my place, becomes below, still underneath the proximal nail fold, and pulls away and adheres to the upper surface of the nail plate as it grows outward. The cuticle forms an important seal between the PNF, proximal nail fold, and nail plate, preventing infectious organisms from getting underneath the skin to infect the matrix or bone. A professional, just throwing in words now. Professional nail products marked as cuticle moisturizers, softeners, or conditioners can be confusing, but keep in mind that these labels are customer driven, as proximal nail fold creams would only confuse a customer. There can be confusion about the cuticle and the names of the other parts of the nail, so make sure you learn this information. The cuticle is dead skin on the nail plate. So why are there products designed to pamper, soften, and moisturize the cuticle? That does not make any sense. Cuticle moisturizers, softeners, or skin conditioners are actually designed for the proximal nail fold, lateral side walls, and hyponychium, not for the cuticle. Cuticle removers are professional products that, when carefully applied to the nail plate, can speed the removal of stubborn cuticle tissue. Misunderstandings about the correct names for the parts of the nail cause a great deal of confusion, so learn the proper terms and use them correctly. Eponychium is the living skin underneath the proximal nail fold found at the base of the nail plate, covering the matrix area. According to research conducted by Doug Schoen, in a 2019 study, the eponychium is a thin section of tissue found on the bottom side of the proximal nail fold. It was discovered to be surprisingly thin, approximately 0.1 to 0.15 millimeters thick, which is 0.004 to 0.006 inches, and consists of only one layer of the stem cells. The eponychium extends from the front edge of the proximal nail fold and stops at the nail matrix. The proximal nail fold is the section of skin over the eponychium. This flap of skin covers the nail matrix and the nail plate. The eponychium is often mistaken for the cuticle. They are not the same. The cuticle is the dead tissue adhered to the nail plate. The eponychium is the underside of the proximal nail fold and is the living tissue that makes the cuticle. The cuticle becomes eponychium, which is found on the underside of this area, where it completely detaches from the eponychium and becomes strongly attached to the new growth of nail plate. It is pulled free to form a seal between the natural nail plate and the proximal nail fold. Determining the difference between the cuticle and the eponychium is easy when you use these simple checklists. Is the tissue adhering directly to the nail plate but easily removed with gentle scraping? Is the tissue very thin and colorless but easily visible under close inspection? Is the tissue non-living and not directly attached to living skin? If you answered yes to any of these questions above, then the tissue is called the cuticle. Does the tissue cover the nail plate and nail matrix except the luna? If you cut deep enough into this tissue, will it bleed? You don't want to find that out on a client. Magnifying the nail. Use a small magnifying glass to examine the cuticles and PNF, the proximal nail fold, at least 10 friends or classmates. Observe how the thin cuticle tissue attaches to and rides on the top of the nail plate as it emerges from under the eponychium at the base of the nail plate. Then examine the PNF. And what's the PNF? Say it with me. The proximal nail fold. To see how these two differ in appearance, identify the one that can be removed and the one that should never be cut. If you answered yes to any of the questions above, the tissue is called the proximal nail fold, the PNF. Nail technicians can gently push back the PNF, but are prohibited from cutting or trimming any living tissue, which includes the PNF. Even if the skin appears dry and hardened, it is part of the living PNF. Cutting any part of the PNF or living tissue or other living skin is outside the scope of nail technology and not allowed under any conditions or circumstances. Nobody, not even a doctor or a client, can give a nail technician permission to cut living skin. Hyponychium. The hyponychium is the slightly thickened layer of skin that lies beneath the fingertips and the free edge of the nail plate. It forms a protective barrier that prevents microorganisms from invading and infecting the nail bed. Treat this area gently, because when it is damaged, the nail plate can separate from the nail bed, making infections under the nail plate possible. Specialized ligaments. A ligament is a tough band of fibrous tissue that connects bone or holds an organ in place. Specialized ligaments attach the nail bed and matrix bed to the underlying bone. They are located at the base of the matrix and around the edge of the nail bed. Check in! What is the main difference between the cuticle and the eponychium? Name the major parts of the nail unit. Explain the difference between the nail bed and the nail plate. What part of the nail unit contains nerve, lymph, and blood vessels? And that'll do it for this video. Don't forget to comment, like, share, and subscribe. I want to grow this channel. Help a girl out. I want to be one of the cool kids. I hope this video was helpful to you. I appreciate you watching. Have a great day. Thanks. Bye.